Hi guys, I'm Becky. Welcome back to Wellness in the Pelvis. I'm a pelvic floor physical therapist here to help you understand more about your body, especially your pelvic health. And today it's not about the pelvis, but about the hand, which is kind of far from the pelvis, but still relevant. We're going to talk about nursing thumb or mother's thumb and what you can do to keep it from happening, but how to help it if it does happen, especially if you are a new parent. So let's shed some light on what's going on down there. Nursing thumb or mother's thumb, or if you want to be really fancy, DeQuervain's tenosynovitis, is an inflammation of the muscles on the side of the thumb. So that's where you're going to feel pain if you are having problems that are related to this condition. And so the reason why this happens, it's usually like a chronic overuse thing. And it's usually because you're loving your child and holding them, which is good, but then it wrecks your body. So you'll know if you have DeQuervain's syndrome if it feels tender here. So there you go. If you're having a hard time pinching, grasping, lifting things with your hands, or even if you're just holding your wrists in a way to help support maybe like your baby's head or something. So things that you can do to help this feel better if you find yourself having this pain here on the side of your thumb. One, a really, really simple stretch. You're going to put your thumb on the inside of your palm, then make a fist around it, and then you're going to drop the thumb side of the wrist down. You'll know it will feel like a stretch. Don't overdo it. Back off a little bit if it's too much, but this is a stretch. You're going to hold for 30 to 60 seconds 5 times a day. It's a lot, but we got to calm that tissue down and get it moving again. Next, you get ice or heat, whichever feels better. Ice, just on the side of the wrist, no more than 15 to 20 minutes at a time. Your body just doesn't need it. And heat, probably about the same. You just want to make sure that you're not burning your skin, of course. And you can do those as many times as you want, but typically 3 times a day is plenty. Medication, if you're allowed to take it, simple over-the-counter stuff is fine. Ibuprofen or Tylenol or Aleve, those are all fine as long as your doctor's okay with it. The next thing that you can do is massage it. You don't need any special tools, except I would recommend using something other than your other hand so you don't then irritate the other side. But I use a spoon, nothing fancy about it. And you can just take the ladle side of the spoon and press and drag right along that sore area. You don't want to try to rip your skin off, don't hurt yourself, but just gentle pressure. And you can do that for 5 minutes a couple times a day. Keep it really simple, but get that tissue reorganized and moving better. And posture. We know about posture for our backs, like sitting up straight and tucking back your shoulders, tuck your chin. We don't think about posture with our hands. And so from now on, you are going to think about Barbie hands. Barbie can't bend her wrists, at least most can't. So when you are doing things, especially like picking up your baby and holding them, you want to do that with a straight wrist, not curled in. This curling in movement is what irritates this tissue here on the side of the wrist. There are ways that you can just take pressure off your wrist in general, so that way you don't have to strain this side of the thumb. One is wearing your baby around the house instead of carrying them. So if you have any infant carriers, whether they're like the soft fabric ones or a more structured one, gives you your hands back, friend. And then also while you're nursing or just holding your baby while sitting down, making sure that you have enough pillows around you where you aren't trying to lift and support them and they can rest more easily into the surface instead. If you've had it for more than 2 to 4 weeks, especially if it's getting worse, call your OB or your birthing provider. Let them know what you have going on. They'll be able to direct care, whether it's in their office or somewhere else. You might need a steroid injection or something to take that inflammation away. PT, whether it's pelvic floor or just regular orthopedic PT or even a hand specialist, those exist, can help take care of this. If it's really bad, you may need surgery to help take tension off that swollen area, but that's very few and far between. So what questions do you have? Let me know in the comments down below. Thanks for checking out my work, guys. We'll see you next time. Bye.